today. We have W. Shaw and Associates, Mike Dodd and Stephen Anderson, and they are also the people that provided our lunch today, so be sure and tell them thank you for that. They're going to be talking to us about your Blue Cross Blue Shield insurance and some of the benefits that are associated with that, just as a friendly reminder, so pay close attention to what they're going to say. As of right now, Sharday, our business analyst in IT, is going to come up. She's going to be speaking to you about our ESS system. We are encouraging people to begin using that. We are going to start we've already began the process of doing our online enrollments for benefits next year, so it's going to be to your advantage to familiarize yourself with that portal. And Sharday, thank you.
Happy holidays. I'm just going to walk through. So as Ms. Shelley just told you guys, we're really transitioning to a lot of web-based, online, self-service type things. So in the spring, we'll be doing our benefits online. So the enrollment that you usually do, any changes that you need to make, we'll be doing all of that online. So I just wanted to start with kind of doing a couple of trainings, if needed, to inform you how to log into ESS. Everybody has seen this portal, I hope, but this is the ESS or Employee Self-Service Portal, and I have just want to share all the benefits of what you can do in ESS on your own without having to come to HR or anything. So right now, we can already access our employment information anytime, 24/7. You can view and print your payroll information, so you should be able to see your checks on there. You can update personal information, so if you have a phone number change, address change, track your leave balances, so time off, that type of thing, and then also any private documents that HR might need to share with you, that will be available and is available through ESS right now as well. Coming soon, our online benefits enrollment and changes will also be available through ESS. So as far as training, so I have not set up. I've identified a couple of dates that we can have some ESS trainings, and I just want to share what you can expect and why you should attend. So step-by-step instructions, how to access and navigate the ESS portal, just a summary and a demo. I know a lot of people are visual, so I can send out a PowerPoint all day, but some people might actually need to see the walkthrough step by step, so that's great. You can see all the features and functions. Why should you attend? At the end of the training, everybody should at least be equipped with the knowledge to access it. So what link do I go to? How to log in, so with the appropriate credentials, navigate the portal, and then be able to access your information. The training format, so the how, basically. I want to do two different formats. In-person training is always good to be available face-to-face, and I will be having some trainings here at City Hall, but then I will plan to go to the PD and also some of the fire halls to try to coordinate and be at those locations as well for convenience. And then also some webinar and online training. So I will be sending out a link to kind of like GoToMeeting, but you'll get more details about that. Just, again, offering flexibility and convenience for people who just can't attend an online training, in-person training. So to the right, you'll see in January, I have identified quite a few dates, and these are tentative, but these are just dates, just to show you that we're trying to meet everybody's need here. And so we'll be offering the trainings in January and February. I have January kind of planned out now, and then I'll move forward with February later. Okay, so that's really what we just wanted to introduce, that we will have some ESS trainings happening, and it's very appropriate because we're talking about benefits, and that's really just convenience of being able to look at any benefits that you have and just employee-related information in general. Okay, so more information and details to come. Thank you.
Quick question.
Oh.
I'm a little jealous here. Can't you come down to the road department?
I absolutely will come to the Rose Department.
Will.
I didn't mean to leave y'all out.
Yeah, she will.
I didn't mean to leave y'all out.
And that's January 2020, I just noticed.
Oh, did I put 2019?
I didn't catch
Okay,
it either, so,
2020.
yeah,
Next, this coming month.
I just noticed it myself.
Okay, let me pull his presentation back up.
I'm gonna do one other thing real quick, Mike.
Thank you.
And one other thing that I want to just touch base with everybody about is the flu shot bills you're still receiving. They have told me that they are in the process of refiling those. So to disregard them at this point, Blue Cross gave them some additional codes to file those with. It would take 30 to 45 days is what they reported. So they are aware of it and supposedly have pulled up everyone that has received the invoice. I've sent the ones in that we've been given, but they've also pulled up everybody that got a flu shot through our HRA clinics and are in the process now of refiling those to get the payments done. Thank you.
So good afternoon, everyone. So we're going to talk a little bit today about kind of getting the most out of your Blue Cross plan. We do this every couple of years to remind you about some things that Blue Cross does, but also going to talk to you a little bit about how to both kind of stretch your dollar and also help the city on the city's claims experience. For those of you who don't know, in insurance, Peter and I, once a year, we have a lot of work when we work on the renewal. So you guys have not seen a lot of changes in benefits in the last many, many years. You're abnormal that way. Most groups have a lot of changes. Deductibles go up, co-pays change, all these things. So we've been able to kind of keep that line pretty good for you guys. And one of the reasons is the claims experience has been generally pretty good for the city. And so I want you guys to kind of see some of the behind the scenes stuff, just to get an idea of what things might cost. Because for every dollar we pay in, Blue Cross then measures how many dollars they spend out. And we see a number. And if that number's over a certain percent, they're going to start hitting us with increases. And we've had groups, Stephen and I have dealt with groups that have had 60, 70% increases, and we've had groups that decreases. So you guys have been more consistent, and we're really happy about that. And part of that has been negotiating with Blue Cross, because we know you guys like them, and kind of staying there as long as we can. We do look at other options every year. Blue Cross tends to be the best fit for you guys. So going to talk about a couple things today. One, we're going to start with where you get your care. That's important. It means a lot of money to the city and to you, and how that affects experience ratings. And then we'll talk a little bit about Blue Cross Blue Shield specific stuff. So how do you determine where you need to get your care? Like I said, it has a big impact on what you do, and there's a lot of places you can get care. There's a NURSELINE that Blue Cross has. You guys have a telemedicine option. You can go to the doctor's office. You can go to what they call convenience care. Convenience care would be your Walgreens, your Kroger, those kind of places. You can go to urgent care facilities, or you can go to the actual emergency room. Yeah.
What do you got to do to get them to let you get care?
What do you mean?
You can't hardly get the insurance company to approve you to get nothing done.
If you're having issues, let's talk. But, we're talking about like you're sick and you go to the doctor. There's nothing, insurance company doesn't approve that at all.
I'm talking like getting special procedures done. They schedule your appointment, the doctor does, then they call you the day before the appointment and say, well, we have to cancel the appointment because your insurance ain't going to approve.
Because it hasn't been approved. There are some things that have what they call pre-approval.
They don't want you to approve for paying that bill, the premium every month, but they want to approve you to get
Well,
something done.
and there are things that have prior approval required. That there actually are not a ton of procedures that require that, but there are things that have prior approval. When you have those issues, call our office, let us talk to Blue Cross too. Sometimes Blue Cross has taken a while. Sometimes the doctor hasn't provided something because it's very specific in the doctor's contract. This will be approved if the following conditions are met. And sometimes they haven't provided all that data. So they send a request to Blue Cross comes back and says, we need something else, and it goes back and forth and back and forth. I've seen things get approved at 6 a.m. right before a procedure, but, call our office if you run into that. I think what we're talking about today is going to be the more, I'm sick, I broke my leg, those things that don't require prior approval. So since it is the holidays, we're going to let our friend the gingerbread man here give us a couple examples. So the first one, telemedicine. This is fairly new to you guys. You guys have had an option for a few years, but this year the city really stepped up and they provided a free telemedicine program to you. So you have an option to talk to a doctor for free through this. So that can be for your more minor routine stuff. So like for instance, if you have a pink eye, you might want to go and call through telemedicine, call Teledoc. So just a couple questions here, and this is how I think of Teledoc. You know, who here's been sick? We've all been sick. But when you're sick, you usually know what's wrong with you. Right now, I have a sinus infection. There's no doubt. I know what it is. So where do you go for treatment? Without a telemedicine, I'm going to go to my doctor's office. It means I make an appointment. Or I'm going to go to a walk-in clinic, maybe to urgent care. How many people like to sit in a waiting room? No one. Because you are never going to be the sickest person in the waiting room. Somebody there is going to be worse off than you, and you're probably going to get sicker by being around them. You know, it'd be a whole lot easier if you could get treatment at your house or at your office or in your car. And then how often do you know that if you have this one prescription, it will take care of things? My wife works for Vanderbilt. She works with kids. She brings home the funk from kids. And she has an immunity like you wouldn't believe, but she passes it on to me. And so I get bronchitis once a year. I know what it is. I know I need this specific prescription. So I know what it is. Without telemedicine, I've got to go to the doctor and go from there. When I was growing up, my mom or dad would just call the doctor and they'd prescribe it. Doctors don't do that as much anymore. If you have a relationship with your doctor like that, that's awesome. That's kind of gone away. So on the telemedicine side, the city has provided Teledoc. It's provided by the city to anyone who's on any of the health insurance plans. So if you're on plan 1, 2, or 3, you get Teledoc. It lets you talk to a doctor 24/7, 365. My wife has used Teledoc on Christmas Eve before, okay? So Teledoc is, I always tell people, it's kind of like Uber for doctors. It's doctors are working in their off time, taking phone calls, and helping people with things. So on Christmas Eve, yeah, there was a longer wait because there's not a lot of doctors who want to talk to patients. But on average, your response time is 10 minutes. So average, you hit the button, you want to talk to a doctor, within 10 minutes, you're talking to a doctor. I was going to be brave, and I was actually going to do a Teledoc consultation for my sinus infection, but I wasn't sure what the wait time was. I just looked, and they said currently they're expecting 11 to 15 minutes. So the 10-minute average is pretty active. This time of year is as bad as it gets because it's cough, cold, flu season. Like I said, there's no copay for your consultation. So that's why we always want to start, kind of where we're going to get coverage, start with Teledoc. If you're having chest pains, you don't use Teledoc. But if you have a sinus infection, if you have a cough, if you have a cold, try it. We tell people that Teledoc's approval ratings are like 98%. Rarely does someone ever call in and not think that at least helped them. And then the other important thing is that last bullet point. If you're on the medical plan, you have family Teledoc, even if your family's not on the city's insurance, okay? So if you have employee-only insurance, you can still use Teledoc for your spouse and children. And it's actually anyone in your immediate household. Teledoc will allow you to use it for parents that live with you. So that's a very, very nice benefit that's provided by the city. So how does it work? The most important thing with Teledoc is, guys, you got to register up front. If you have not registered for Teledoc, you download the Teledoc app or go on their website, teledoc.com, and you punch in your basic information. It's going to find you. So you're in their database. You put in very basic information. You're going to put in your name, your birthday, your email address, and your zip code. I think that's all you're going to put in. And it's going to pop up and say your benefits are provided by the city of Hendersonville. From there, you can set up your username and password. Once you register, you're going to be asked to fill out some health information. So just like when you go to the doctor, they give you that clipboard to fill out. You know, you have what allergies do you have, what medicines are you taking. So the Teledoc doctors will need that information. Then if you're sick, you either call Teledoc, 1-800-TELEDOC, or you connect through the app or the website. If you connect by phone, someone's going to do an intake. They're going to ask you what's going on, and then they're going to either push you to a doctor or have a doctor call you back. If you go on the app, you're going to answer those questions, and the questions really are, who do we need to talk to, basically what's going on, and do you want to upload any pictures? So I've got a client who was holding his cat, doorbell rang, the cat scratched him. And he was like, I think that's infected. And he took a picture, uploaded it, and the doctor looked at it and said, yeah, let me call you an antibiotic. So you have that option to upload pictures from there. If the doctor thinks you need medication, the doctor will prescribe medication for you, and then you can go pick that up. I've used it many times. I've used it, and within an hour, I've got a prescription. So very nice benefit, because otherwise I've got to go sit somewhere in a waiting room. I've got to make an appointment, all those good things. And again, it's free and it's 24/7. So there's a bunch of things that kind of show you what conditions are kind of best suited for Teladoc. And it's all your normal stuff. It's your coughs, your colds, your flus, bronchitis, flu. They can't do a flu test over the phone, but they know flu symptoms and they can prescribe Tamiflu for that. People use it for pink eye, sinus problems, sore throats, all of those kind of things. Anything that you think, a normal primary care doctor situation, that's what you can use Teladoc for. This kind of just shows you their top 10 things they treat. There's my issue, sinus problems, number 1. And then it kind of goes down from there. And then another thing about Teladoc to keep in mind, they also can prescribe short-term prescriptions for you. So if you've run out of a maintenance medication, or you are traveling and you forgot that medication, Teladoc once a year can do a 30-day supply of a maintenance medication for you. They can't give you refills beyond that because you have to see your doctor, but they can get you by. I had a situation one time where I ran out, wasn't paying attention that I was running low on a medicine, and Labor Day was coming up. Couldn't get in to see my doctor. I called Teladoc. They said, yeah, and they gave me 30 days. So they gave me plenty of time to get back into the doctor. So kind of recapping Teladoc, it uses technology, gives you the convenience of doing it wherever you are. Flexibility, 24/7, 365. Has a broad provider network. So one thing I didn't mention, when you're doing that initial intake, either through the app or the phone, they're going to say, where are you? I'm in Tennessee. Okay, they're going to pair you with a Tennessee licensed doctor. They have doctors all over the country, but they need to know where you are so that doctor's licensed to take care of you. And then it's beyond cost effective because it's free. And telemedicine typically is not free. There's usually a copay for it. So we had telemedicine with Blue Cross Blue Shield before we added this Teladoc plan, but you guys had to pay a copay. It was either going to be $30 or $38 depending on which plan you're in. The city stepped up this year and provided this so you guys have free coverage. So I always tell people, try it once. I think you really will like it. And the people I've talked to here who have tried it have had a good result. So what if Teladoc doesn't work? Next step up for kind of those immediate things, those after hours, off hours type things, is urgent care. So it's a more urgent option. So you got a Meyer burn. So our gingerbread man there stayed in the oven a little too long, got burnt. So he needs to go and get urgent care treatment. So at urgent care, they're not equipped to handle life-threatening emergencies, but they're equipped to do more than your regular doctor. They're there for things that if you delayed treatment, you would have a serious impact. They're more cost-effective than the ER. We always tell you guys ER is the most expensive thing that we can do in medicine pretty much. And the waiting time is going to be way less. The average urgent care cost is somewhere between $100 and $200, so way cheaper than going to the ER. So what kind of conditions are suited for urgent care? You see a little bit of bleed over from Teladoc, but not a lot. Sprains, a really high fever that you need to see somebody about, cuts if you need a couple stitches. If you have a minor broken bone, if you break a toe or something that's not going to require surgical, urgent care can deal with that for you. And then we step up to the emergency room. The emergency room is going to be for those really, really life or limb threatening type emergencies. So our friend the gingerbread man, you break a bone and it's a major break. You need to go to the emergency room for that. So you have emergency rooms are equipped to handle everything. Anything life-threatening, they can handle. They do a lot of times have long wait times. One study I've looked at, average wait time of 4 hours. And I've certainly waited that long in an emergency room before. They they triage patients there. So if you go in with something that's not as emergent, then they're going to keep putting you behind people who are worse off than you, so you might wait. And high costs. Average emergency room visit's about $1,200. And you guys have ER copays of $250 in two of your plans. In those plans, you are going to pay $250, but that extra $1,000 comes back on the claims on the city. So kind of being aware. Peter and I looked at a report last year of emergency room usage, and we had some people who went for sprained ankles. We had some people who went for stomach issues. We had people who went for things. That's why those first two options, teledoc and urgent care, make a lot of sense. You have other options. Obviously, in the moment, you might not know what it is. I get kidney stones occasionally. I want it dealt with. I'm not going to go anywhere but get me to the ER and get me some pain medicine. Maybe it's not life or limb threatening, but that pain is so severe that you deal with it that way. But you do have other options. That's kind of trying to remind you guys of that. So what do you do? Kind of things for emergency room. They're the biggies: chest pain and shortness of breath, and things like seizures and poisoning and the big stuff. So kind of keep those in mind and use the emergency room for those. But if you have other options, use those. It was going to save you money. It's going to save the city money. So I found a chart that kind of gave you an idea nationwide what some of these things might cost you. And these are the non-emergency things, but things people do go to the emergency room for. So like sore throat. There are people who go to the emergency room because they have a sore throat. $525 because it costs that much to walk through the door pretty much. If you went to urgent care, $94. It's like going to your doctor. Hey, if you use teledoc, it costs nothing. Looking there, strep throat, $531 versus $111 versus 0. So you kind of see that trend there, that there's a significant drop-off as you go. This I'm not going to even try to make you guys read from here, but it does show you that kind of continuum of NURSELINE, teledoc, convenience care, and it gets more expensive as we go. So it's all about being aware of what your options are and what's out there for you. So that's where you get care, and that's how that can affect the city's claims. And again, the city has a lot of money put into benefits for you guys. Getting the city to pay more because of budget is tough. So when we have increases, we either have to change benefits or we have to raise your cost, and we don't want to do that. In fact, last year we lowered your cost some. But if we can kind of help control those claims, obviously it works. So a couple other things, prescriptions. One thing is using generic prescriptions. Most of us here do use generic prescriptions. There are some people who don't. And I always like to kind of show you an example. So if you take Crestor, or you take the generic, brand name Crestor, on your plans that have copays would be a $65 copay. Not the end of the world. It's expensive, but for what you're getting, it's not a bad deal. But the problem is, behind the scenes, the plan's paying over $900 a month for that. So over the course of a year, that's over $10,000 that the plan has to absorb because you're taking brand name Crestor. If you go to the generic, at most, it's going to be a $15 copay. Your generic copay is $15, and it's probably going to be much less than that. But depending on where you get it, it could be up to that. And the plan cost drops to about $40. So we go from spending $10,000 for one person's drugs to spending $500. $10,000 is more than one person's entire year premium. It's actually about a person and a half. So if we have someone who does that, that absorbs 1.5 people's worth of premium. And then we have more of that. All of a sudden, our claims are high. There could be situations that you have to take a brand name. Okay, that happens. But your plan is specifically designed to give you choice. Blue Cross Blue Shield wants us to do a type of plan that's going to punish you for using brand name. You guys don't have that yet. And when I say punish you, basically they want you to pay the difference between generic and brand. And we negotiated with Blue Cross when we came back to them not to have that yet. So they might push us there at some point, but we're not quite there yet. that would, you have the choice, but your choice can impact both your paycheck or your wallet and the city. Yeah.
Are generic drugs as effective
So typically, generic drug's the same thing. Now, there are people, I run into it all the time, and I'll tell you the most common is Synthroid. Synthroid versus levothyroxine. There are people who say generic does not work. I have to do brand name. And if that's the case, that's perfectly fine. But we have a lot of people who, when you're looking at a small cost difference, we have a lot of people who might just go for the brand name. Or if you're in Plan 2 and you hit that, you got a really low out-of-pocket maximum, and you hit that, and now it's, quote, free to you because you're not paying for it, some people might use that. But what a generic drug is, it is the same, has the exact same ingredients as the brand name. So once that brand name's on the market for a while, then the generics come out. If you have a newer drug, one of the ones that's that doesn't have a generic, you have to do brand name. It is what it is, but just kind of being aware. And then kind of taking it one step further, be a consumer sometimes. So there's a website called goodrx.com. So GoodRx is nothing more than, it's a coupon website. It lets you punch in your drugs, and it tells you where the cheapest place to buy those drugs will be. So I looked up that generic of Crestor. If you got a 90-day supply, you're going to pay up to a $45 copay, $15 times 3. GoodRx for Kroger, they have a coupon for $15.27 for that same 90-day supply. So you can go to your pharmacist and say, hey, look at this and tell me which is cheaper. If the GoodRx is cheaper, just make sure they don't run that through insurance, because GoodRx is replacing your insurance on that drug. More often than not, it's not going to be, but there are examples out there that will work really well. If you get one of those really expensive prescriptions, check that out. The other thing is when those real expensive prescriptions, there's manufacturer coupons that will kind of bring that cost down too. Some of those, if you ever get prescribed one, Stephen had one yesterday, what was it, $20,000 a month? Yeah, it was a drug for psoriasis. It's a $20,000 per month drug. And I have somebody who takes that same prescription. She said it's a lifesaver, but it's so potent that they have to monitor her kidney function and all these things because it can actually make things go bad. And the minute her levels change, she has to come off of it. But it's $20,000 a month. Well, they have a coupon where she's paying like $30 a month for it. So there's some things out there like that. Your doctor will usually help you with those things, but we can certainly help do some of that research for you too. So that's a lot of nice, boring stuff on kind of how to stretch the dollar a little bit and where to get things done. The other thing we wanted to talk about today is Blue Cross Blue Shield. So just by being in one of the Blue Cross Blue Shield plans, you've got a lot of stuff built in. And we've talked about this a couple of years ago. There's some programs, you might not use it. Like I said, they've got a telemedicine program in there. It's not as good as yours. So you don't want to use theirs. We want to use Teladoc. It's awesome. It's free. Let's use it. Let's don't pay a copay to Blue Cross. But Blue Cross has several things built in. First and foremost is their website. It's called Blue Access. You guys have had, with the exception of having Cigna in there for a year, you guys have had Blue Cross forever. Most of you probably at some point have logged into the Blue Cross website. But if you haven't, that website's going to give you all your plan details. It's going to tell you how much your deductible is, how much of your deductible you've met, what your copays are. It's going to give you all that stuff. It's also going to give you an ID card. You don't have your ID card, click print, or you can request a new ID card. It's going to let you track claims. You question how a claim got paid, it's there. All things that we can also pull for you, but you have access 24/7. Once you're in Blue Access, there's several things in there. One's the Member Wellness Center. In the Wellness Center, there's a lot of things to kind of go with the WellPoints program, just kind of to supplement or augment. What Blue Cross calls a personal health assessment, it's a health questionnaire. It's one of those things that says, hey, how much TV do you watch a day? How much do you exercise? What do you eat? And all those things, and it comes back and says, these are the things you should be working on. It also has health articles. You want some information about whatever health issue, it's built in there. It will integrate with your Fitbits, with your health trackers, so you can kind of track everything on one dashboard. And then they've added a few things lately, what they call digital self-guided programs. There's some programs that are specific to certain conditions. Personal challenges, we'll talk about some of these as we go through. Their app is called ALWAYSON. It's going to give you mobile access to the same information you get through their website. It's just a cleaner, easier version of the website to use from your cell phone. So we talked about self-guided stuff. So they have 15 programs that let you kind of go through certain things like looking up their blood pressure, cholesterol, diabetes, sleep, stress. Some programs that you can kind of go through, learn about issues that you might be dealing with. And then they have self-directed health courses. So those are going to be longer things, step by step you walk through, and let's say tobacco cessation or sleep health. It's going to talk to you about sleep health, let's use that. It's going to walk you through how to get better sleep, what to do to get better sleep, what to eat and drink before bed, what not to eat and drink, all those kind of things. But it's self-directed. You do it at your pace whenever you want to. Some of us are really driven by challenges and goals and all those things. We were talking in the office this morning, a lot of us wear Apple Watches. And we'll pretty much do anything to close those rings during the day. So 10 o'clock at night, it's like, hey, you need 20 more steps or whatever it might be. A lot of us will do that because we're driven by those challenges. So Blue Cross has developed 42 challenges. And they're anything from 7 days to 2 months. And they're just personal, kind of drive you, like activity, nutrition, tobacco cessation, stress management, sleep things, all those type things. So if you're one of those people, it's kind of canned and done, ready to go for you. So also, in addition to some of those things, they have member discounts on a lot of things, and we'll talk about some of these as we go through. But for instance, there's a 20% discount at Reebok.com. There's discounts on Jenny Craig. There's discounts on laser vision things. There's a lot in there. When you get in there and start clicking around, there's a lot. Some of them are great discounts. Some of them are kind of nominal, but they're there for you. So let's talk about Fitness Your Way. So we have promoted for years the Fitness Your Way program. It is a great program. It's $29 to join and $29 a month. Gives you access to tons of fitness facilities. We all learned last week, you guys learned about the time we did, the YMCA is pulling out of that program. So that really kind of hurts up here because a lot of us, my wife and I, we do it for the YMCA membership. It's cheaper to do it through Blue Cross than it is to buy a Y membership. So when the Y pulls out, we still have Planet Fitness, Golds. Sumner Chiropractic has a gym in there, and you can go work out. You want to go up to Gallatin, the Gallatin Civic Center will still be there. So if you want to still use this program and you want the indoor pools and those things, you can do that through Gallatin. Yes?
We've had this for years. They've changed names, correct?
Mm-hmm. It was called Fitness Blue.
Blue Parks or something?
Yep.
Yeah. So if you're confused and never heard of this, you've heard of it, it's just changed names.
They just rebrand those things all the time. It's called Fitness Your Way now. So if you're currently signed up and paying the $29 a month, you just keep on. If the YMCA is an issue, you certainly can cancel it. When you signed up, there was a minimum of a 3-month commitment. So my guess is everybody in here has been, if you're on it, you've been on it for more than 3 months, so you can cancel. Or you can try those other facilities. It's still a good deal, but that does hurt to lose the Y. That's the main reason my wife and I use it. But like I said, there's over 10,000 gyms nationwide, and we still have access here. Blue Cross also has a thing called Healthy Maternity. If you're not on child number 1, probably not a big deal. But if you're on child number 1, it's kind of overwhelming, both the insurance side of it, how do claims get paid and all that, and then all the things you're going through. So Blue Cross has Healthy Maternity. You register, and then you're assigned a maternal nurse, and that nurse kind of walks you through what to expect, all the way from when you sign up till after the baby's delivered. So it's going to be a lot of things. It's going to be, and it's one-on-one. So it's over the phone or by secure message. They're going to help you kind of know how the benefits work through that process. They're going to help you explain, understand what to expect when you get to the hospital, all those things. And then they'll actually start sending you stuff about postpartum and all that kind of stuff. If you sign up before you're 20 weeks pregnant and you intend to breastfeed, there's also discounts on pumps. So there's some good stuff there with that maternity program. I'm going to skip the NURSELINE. Like I said, you guys have something better. Teledoc is better than talking to a nurse 24/7. It's probably better to talk to the doctor directly. So Blue Cross also does what they call health coaching. Health coaching, there's two different things. There's lifestyle and then there's chronic issues. So lifestyle is going to be, you go get your physical and they notice your blood pressure's gone up. And then you go get your next physical and your blood pressure's gone up. Blue Cross is going to reach out to you and they're going to say, hey, we've noticed from those stuff we're getting that you're trending up on some of these things. And they're going to assign a nurse, and that nurse or that health coach is going to kind of walk you through what you can do to offset that, okay? It's voluntary. You don't have to talk to them, but it's there. It is confidential. It's one-on-one. You're going to talk to the same health coach. Unless that person's out of town, you're going to talk to the same health coach all the time, either by phone or secure message. So you can shoot them emails. They'll answer back. That way you don't have to reach out to anybody if you don't want to. They'll help you with setting some goals, and sometimes it's just good to have motivation. You know, they kind of check in with you and say, "Hey, how's the eating going? Are you doing better with this? Are you doing better with that?" On tobacco cessation, "Hey, are we still good? Have you smoked?" and all those kind of things. So they'll kind of coach you on those issues. And then a step up from there, we've got chronic care management. So chronic things are going to be those conditions listed: asthma, diabetes, COPD, artery disease, heart failure, depression. When you are diagnosed with one of those things, Blue Cross typically gets notified, and they're going to reach out the same way I just mentioned on the lifestyle coaching. They're going to reach out and they're going to educate you about it. If you are not a diabetic and you are diagnosed as a diabetic, you might not even know really what that means. I had someone one time that was diagnosed, and he thought that meant he had to stop carbs altogether. And so until he went through something like this, he cut carbs like crazy. And then someone explained to him, no, healthy carbs and this number of carbs, and walked him through that. They're also going to try to help you find local resources if you want them. That same example of the diabetic, there are classes. They kind of teach you how to live with it, how to manage it. Same thing, they help you set goals. They're going to coordinate scheduling of services. It's kind of your partner is going through that. And that's all these people do, is they address those few issues with people all across the state. And I think last but not least is tobacco cessation. We have had this both with Blue Cross and Cigna for years. You've got an option. If you want to try to quit using tobacco, you can sign up. You can call in and look for resources. You can message the people. They are going to provide an 8-week supply of either over-the-counter patches or gum, depending on what's best for you. They'll provide that for free to kind of help you stop. Obviously, you guys get a tobacco-free discount, so that's also good. But you need to engage that cessation program, and it will help you kind of get through those first few weeks. That is a lot of nice and boring stuff. Typically, people have questions because, we all experience something differently. Anybody have questions? Yeah.
I guess I'm still old school, but
Mhm.
I like a paper EOB.
Uh-huh.
Do we not get those? It seems like I don't, sometimes I get them, sometimes
So they do monthly EOBs.
I don't always get them.
Yeah.
You go online
Mhm.
a little,
Mhm.
but I just wondered about the EOBs. I'll be expecting it.
There is a place, as you sign up online, that you can opt out of paper. But if you're getting some of them, I don't think you've opted out. But they do it monthly, so it's never going to be right after your visit. You're going to kind of get it all in one report. And I don't like the monthly either, but it is what it is.
But it just didn't seem like I was.
And I always, when I'm signing somebody up, I always opt out of the electronic only. So I think people like to just see that on paper. Yeah. That's good because, you can find mistakes on those EOBs. Shelley, you said?
Couple of things, Mike, I thought might be just beneficial to mention. If you want to just touch base about the benefits
as a reminder.
Yep.
And also, talking about the urgent care and ER usage, you might just remind everybody about the option 3, the plan 3 people, the restrictions with that.
Oh, yeah, okay. So Shelley mentioned the benefits portal. We have set up a website that has all of your benefits stuff on it. If you think this is boring, go start reading that stuff. You will not need Ambien. But it has everything on there, and it's actually really good. It's 24/7. And if you just have a simple question, you've got that information on there. You've got all 3 medical plans, you've got your dental, your vision, all the benefits are on there. So it's got all the resources that you would need. So it'll work kind of hand in hand with the eSelf-Serve when you're going to enroll. The physical act of enrolling is one thing, but all that data, all the information about the plans, it has been easy for the last few years because there haven't been a lot of changes for you guys, but sometimes we kind of forget, what's the deductible on that plan? It's all there. So it's there for you. The wellness newsletters are there. All the WellPoints information's there. It's all there, and it's just hville.tnbenefits.com. So it's just,
HR website.
yep, and there's a link on the website. And then Shelley's mentioning urgent care and ER. So you guys have 3 plans with Blue Cross Blue Shield, Plan 1, 2, and 3. Plan 1 and 2 utilize Blue Cross's Network P. Network P is the full network. So pretty much if a doctor takes Blue Cross, he or she is going to be in Network P. If a facility takes Blue Cross, they're going to be in Network P. Option 3 is Network S. So we added it a few years ago to kind of give you guys a lower cost option. Network S is a smaller network, but typically what we see is the issue with the facilities, more facility driven than doctors. And the big thing here is we're sitting in Hendersonville. HCA TriStar is not in Network S. So Hendersonville Medical Center is not Network S, okay? So could be an issue. So, when you go into that plan, you know that. Now, Sumner Station is, Sumner Regional is, going down into Nashville, Vanderbilt, St. Thomas, they all are. But Hendersonville and Skyline are not. They are Network P only. So what Shelley's mentioning is, okay, so we're sitting here today and somebody has an emergency. They go over to Hendersonville. How's that going to work? So just as a kind of basic thing, Blue Cross and HCA are constantly negotiating. They never quite live in harmony with each other. So what happens is if you go to the Hendersonville emergency room, Blue Cross is going to pay more than they would have paid if you had been in network, but they're not going to pay that whole bill. Okay, so we frequently see people get bills. We had an employee here who got a bill for something crazy, like $40,000. And immediately called HR, they called me, we talked. I said, just don't have a heart attack, and let's don't have more bills. But what we do see happen there is one of 2 things. Either TriStar will write it off, or they will offer you a significant discount. In that case, they offered him $1,100, satisfied the $40. So if you can't at all, you don't want to go to TriStar if you're on Plan 3. If you have to go, we will help you work it out. What will happen, and I assume it's going to happen soon, is they will go through these cycles where they'll have an agreement for a period of time that, hey, Blue Cross will pay TriStar enough, TriStar won't bill you. And then that agreement ends, and then they start sending those bills out. And the letter comes out and says, hey, you have Blue Cross and they paid this wrong, is what they say. It's PR. And then they'll come to another agreement. And that'll last for 2 or 3 years, and then we'll have another period. We're just in that gap period right now. So be aware of that if you use emergency, that you could have that issue if you're on Plan 3.
I think a lot of it too is what you're going for, because I don't know that Blue Cross is going to look for somebody going for a sinus infection on Plan 3.
Correct. Yeah, if you're having a heart attack, yeah. And I think TriStar, the same thing. The person here, it was a definite emergency. In fact, the ambulance took him past Gallatin, past Sumner Regional, to Skyline, because they said, you need to go level 2, so we're taking you there. He didn't have a choice. He asked, stop here, and they drove him past. So $40,000 negotiated down to $1,000 is pretty good. We can file a grievance and try to get that $1,000 eaten up, and sometimes they do. One other thing that is not really a part of this, but as we talk about ER, we do also have one other issue that we run into all the time, specifically in Hendersonville. You go to the ER doctors, you're almost always going to get a separate bill, and those bills are going to be out of network. For some reason, the group that they contract with is not in network with any. So I don't care if you're on plan 1, 2, or 3, you have United Healthcare, Cigna, or whatever, you're going to get a bill. I don't think they mind saying it. Mayor Foster got a bill. Same thing, it's like, what's going on? The bill just went away. So if that happens, it's worth calling and saying, hey, you got paid this much, because you'll see on your EOB, will you write off the rest? And they've been doing that. So just kind of be aware of that. I think the name of the group's Old Hickory Emergency Physicians. And we have complained to TriStar about that. You know, if you contract with a group, they need to be in the same networks. There's some discussion at TriStar about that, but that's where it is right now. Care Now bills like an ER. Yeah. So, and it's a TriStar facility. So sometimes it's worth running across the street. Urgent care places can bill as an ER, or they can bill as urgent care. So, you know, sometimes it's worth having that conversation as you go in.
You also got to be careful how you ask them. I thought I was maybe having a heart attack. They took me over to Sumner, and when I'm going in, I say, do you accept my insurance? And they said, yes, sure, come on in. Well, I didn't ask them if they were in my network, and I got a big old bill.
Really?
Yeah.
And we've seen that before, that, you know, you show them a card, or sometimes if you say, hey, do you take Blue Cross? Yeah, they take Blue Cross P, but not S. We have that issue with other carriers. Humana has 2 networks. Do you take Humana? Sure. And they come on in. And it's always a fight. Most of those times, those type bills can either be really negotiated down, or they can go away. Just be aware, do the best you can, but if you think you're having a heart attack, go get it taken care of. You know, we'll deal with all that on the back end.
So you said Care Now is like an emergency.
They bill like an emergency room. So they'll bill you that $250 copay. And there are some urgent cares that do and some don't. I think American Family, I think they bill like kind of like a specialist or an urgent care visit, yeah. It's like if you're on plan 3, it's the specialist copay. Any other questions? Well, guys, just as a reminder, we are here. We are right down the road. If you run into some of those problems, like I said, we had the gentleman who had the ER problem. He and I worked on that for months. Sometimes those things happen, but we're here to kind of help you guys with that. You don't have to deal with it all by yourself. We're working on something that's been going on for a long time that is just a silly situation. I don't think anybody's wrong, but we will keep working on that. And we're happy to talk to providers. We're happy to help you with prescriptions, any of those kind of things. So it's not just the insurance side. We'll do whatever we can. If we need to come see you, you can come to our office, whatever we need to do. So if you have any other questions, Stephen and I will hang around a little bit if you want to talk one-on-one about anything. But we appreciate you guys. Have a happy